So are you pregnant and wondering how to actually prevent common postpartum complications? Maybe you've actually been pregnant before and struggled with pelvic pain or prolapse postpartum. And if this sounds like you, a very important concept to review during pregnancy is managing intra-abdominal pressure, or IAP. This is essential to minimize your risk of a large diastasis recti, or DR, which is abdominal separation, pelvic back pain, and prolapse. So what is IAP? It's basically the pressure in your abdomen that naturally increases when you breathe. A baby growing inside your abdomen causes more and more intra-abdominal pressure, putting strain on the abdominal wall and displacing organs. It contributes to the fascia at the front of the abdomen, or the linea alba, stretching and expanding. And this expansion is actually somewhat inevitable in normal pregnancy, but everybody will get a diastasis recti. But people will have different degrees of it and different experiences postpartum with healing. Some of this is determined by things that you can't control, like connective tissue disorders and having a short torso. And some of it is determined basically by things you can control, such as learning how to actually manage the increased intra-abdominal pressure. How do we do this here? So proper breathing is essential, and ideally intra-abdominal pressure management should be a natural automatic reflex. But when we have a breath in, we have expansion of our lower ribs at the pelvis, and as it relaxes, we exhale. We should have gentle activation of the pelvic floor without bearing down, because that increases intra-abdominal pressure. This may need to be retrained during pregnancy, as posture and breathing patterns can significantly shift and throw off this process. So focus on breathing into your lower ribs at the front, sides, and back. And we want to avoid upper chest and belly breathing. Breathing with proper mechanics also helps strengthen our deep core and pelvic floor muscles, which further helps manage intra-abdominal pressure and contributes to more successful outcomes for mom postpartum. So it's a win-win. We want to avoid breath holding. Sometimes during exertion, like heavy lifting or during exercise, we can forget to breathe. This increases intra-abdominal pressure and puts a lot of pressure on the connective tissue at that front area of the abdomen, as well as pressure on the pelvic organs, such as your bladder. Remember to always exhale on exertion, and you always want to check in during exercise to make sure you aren't holding your breath. Manage constipation in off is also important. With more water and more fiber are your friends during pregnancy, and constipation can lead to straining during bowel movements, so that hugely increases intra-abdominal pressure. You don't want to strain during bowel movements. If you feel yourself starting to do this, exhale throughout to reduce the pressure. A squatty potty can also help. This puts your pelvis in an ideal position for elimination, which takes tension off your pelvic floor muscles and organs, and it decreases the need to strain. It's amazing what women's bodies can do and what they go through to accommodate a growing baby. Be mindful of these tips throughout pregnancy to keep your pelvic floor, your abdominal wall, and your pelvic organs as healthy as possible. And remember that everybody will get some level of an abdominal separation, but it's about managing the intra-abdominal pressure to reduce the severity. Please contact us today to speak to one of our pelvic health specialists to learn more about your body during, before, and after pregnancy, postpartum, and beyond. And we look forward to hearing from you.